In recent years, along with the increase in life expectancy and the aging of the population, chronic diseases in the elderly have become increasingly common and of concern. Among them, gout, also known as gout, is one of the bone and joint diseases with a high incidence in the elderly, causing many negative effects on the health, mobility, and quality of life of patients. Gout is known as a form of arthritis caused by uric acid metabolism disorders, leading to the deposition of urate crystals in joints and soft tissues. In the elderly, impaired kidney function, poor uric acid excretion, combined with inappropriate diet and accompanying diseases such as high blood pressure, diabetes, obesity, etc., make the risk of gout even higher and more complicated. Although not an immediately life-threatening disease, gout progresses silently, recurs many times, and leaves many serious complications if not detected and treated promptly. Therefore, understanding the causes, symptoms, treatment methods, and prevention of gout in the elderly is very important in protecting the health and improving the quality of life for this vulnerable group. 1. What is gout? Why are the elderly susceptible to gout? What is gout? Gout is a form of arthritis characterized by a disorder of uric acid metabolism in the body. Uric acid is the final product of the breakdown of purines, a natural compound found in many foods such as seafood, red meat, animal organs, beer and wine, etc. Normally, uric acid will be dissolved in the blood and excreted through the kidneys through urine. However, when the amount of uric acid in the blood exceeds the normal threshold called hyperuricemia, the body cannot excrete all of it or produces too much uric acid, leading to the formation of sharp urate crystals. These crystals can deposit in the joints, soft tissues, or kidneys, causing pain and arthritis. Typical symptoms of gout include severe pain in one or more joints, often appearing suddenly at night, redness, burning, and sensitivity in the affected joint. The most common joint is the big toe, which can then spread to the ankle, knee, wrist, elbow, and hand. Severe cases may develop tophi, lumps containing urate crystals, under the skin, or complications such as kidney stones and kidney failure. If not treated promptly, gout can progress to chronic gout, causing permanent damage to the joints and seriously affecting the quality of life. Why are the elderly susceptible to gout? Gout is not only common in middle-aged men, but is also a serious health problem for the elderly. The incidence of the disease in this age group tends to increase rapidly, stemming from many causes related to aging physiology and lifestyle. A. Decreased liver and kidney function. As we age, the function of organs in the body, especially the liver and kidneys, begins to weaken. The liver is the organ responsible for part of the purine metabolism, while the kidney is the place to remove uric acid from the blood. The decline in the function of these two organs causes uric acid to accumulate in the blood, forming urate crystals that cause arthritis. This is a key factor that increases the risk of gout in the elderly. B. Unreasonable diet. Some elderly people have unscientific eating habits, such as eating a lot of foods containing purines, red meat, seafood, animal organs, etc., drinking little water, which hinders the excretion of uric acid through the kidneys, abusing alcohol, a factor that accelerates the process of increasing uric acid in the blood. An uncontrolled diet is one of the direct causes that increases the risk of onset and recurrence of acute gout attacks. C. Lack of physical activity. In the elderly, reduced physical activity can slow down metabolism, thereby affecting purine metabolism and increasing the possibility of uric acid accumulation in the blood. In addition, a sedentary lifestyle also makes the body susceptible to metabolic diseases such as high blood pressure, diabetes, obesity, which are risk factors associated with gout. D. Side effects of drugs for chronic diseases. The elderly often have to take long-term medication for underlying diseases such as high blood pressure, heart failure, diabetes, chronic kidney disease, etc. Some drugs, especially diuretics and thiazide antihypertensive drugs, can increase blood uric acid levels, indirectly causing or aggravating gout. 2. Typical symptoms of gout in the elderly. Acute joint pain. The most typical symptoms. The most prominent and easily recognizable symptom of gout is acute joint pain that occurs suddenly, usually at night or early in the morning. The pain can occur without any warning signs, accompanied by the following characteristics. Severe and sudden pain. The patient feels pain like being cut by a knife, pricking at the inflamed joint. Common locations. The big toe is the most common location, followed by the ankle, knee, wrist, elbow, etc. Redness, swelling, heat, and shiny skin around the joint. The pain lasts from a few hours to a few days, then subsides on its own, but will recur if not treated. Difficulty moving the joint. In the elderly, the joints are already aging, so when gout attacks, the stiffness and limited mobility are more obvious. Patients find it difficult to move and walk, especially after waking up or when the weather changes. The appearance of tophi. Tophi are masses of urate crystals deposited under the skin, often appearing after many years of uncontrolled gout. In the elderly, tophi can grow large, causing joint deformities, destroying bones and surrounding soft tissue. Common locations include around the joints of the feet and hands, ear rim, back of the elbow. Tophi are initially soft, then gradually harden, and can rupture, causing ulcers and infections. Accompanying systemic symptoms. Gout not only manifests in the joints, but can also cause systemic symptoms such as mild to high fever during acute inflammation, fatigue, loss of appetite, difficulty sleeping due to pain. In many cases, patients may have digestive disorders or high blood pressure if the disease persists. Kidney and urinary system damage. Elderly people with long-term gout are prone to kidney-related complications such as kidney stones due to urate deposition, chronic kidney failure, oliguria, painful urination, or blood in the urine. This is one of the leading causes that makes gout dangerous if not well controlled. Recurs more often in the elderly. Compared to young people, the elderly have a weakened immune system, reduced liver and kidney function, and are prone to underlying diseases such as diabetes and cardiovascular disease. Therefore, gout in this age group often recurs continuously, is difficult to treat completely, and can easily lead to serious complications. Conclusion: gout in the elderly not only causes pain, affects the quality of life, but also has many potential serious risks if not detected and treated promptly. Recognizing typical symptoms such as acute joint pain, tophi, joint stiffness, kidney damage, etc. will help patients be proactive in taking care of their health. In addition, the elderly should maintain a healthy diet, control weight, limit alcohol, and have regular checkups to prevent disease progression. 3. Gout diagnosis process. Diagnosis of gout in the elderly requires a combination of clinical symptoms, blood tests, and some imaging methods. Specifically, clinical examination. Take a medical history, joint pain, frequency of gout attacks, family history, etc. Examine the inflamed joints. Look for tophi. Blood test. Serum uric acid. Usually greater than 420 mol/L, 7 milligrams per deciliter. However, it can be normal in acute gout attacks. Erythrocyte sedimentation rate vs. CRP. Increased in acute inflammation. Blood count. Sometimes leukocytosis. Joint fluid aspiration, if necessary. Under a polarized microscope, needle-shaped urate crystals can be observed, a characteristic sign that helps confirm the diagnosis of gout. Imaging. X-ray. Detect joint space narrowing, bone damage in the chronic phase. Joint ultrasound. Supports the detection of effusion, urate crystals. CT scanner or MRI. Used in cases where complications need to be assessed. Differentiation from other diseases. elderly people often suffer from many other joint diseases, which are easily confused with gout, for example. Rheumatoid arthritis, symmetrical joint damage, often found in the hands. Osteoarthritis, pain during movement, no acute swelling. Pseudogout, arthritis caused by calcium crystals, pain similar to gout, but the crystals are not urate. Therefore, accurate diagnosis is extremely important for the right treatment. Special notes when diagnosing in the elderly. Some cases do not have obvious symptoms or uric acid levels are not high in the early stages. It is necessary to combine many factors. Should not rely solely on blood tests. Regularly check blood uric acid, especially in people at high risk. Early diagnosis helps prevent progression to chronic gout and joint deformities. Conclusion: diagnosis of gout in the elderly requires careful and comprehensive assessment. If you or a loved one has suspicious symptoms, go to a medical facility for timely examination and testing by a specialist. Early detection not only helps with effective treatment, but also prevents serious complications to bones, joints, and kidneys, contributing to improving the quality of life in old age. 4. Principles of gout treatment for the elderly. Treatment of acute gout. Goal: rapid pain relief, anti-inflammation, and mobility restoration. Commonly used drugs. Colchicine, lower dose than for young people. Avoid high doses due to the risk of toxicity to the kidneys and digestive system. NSAIDs, non-steroidal anti-inflammatory drugs, need to be very careful. Only use short-term due to the risk of stomach ulcers, kidney failure. Corticosteroids, used when NSAIDs are contraindicated, can be injected intra-articularly or taken orally, need to be closely monitored. Treatment to lower blood uric acid. Indications: after controlling acute gout, long-term maintenance treatment is needed to prevent recurrence. Uric acid-lowering drugs. Allopurinol. Good effect, but dose adjustment is required according to kidney function. Febuxostat, a good alternative in patients with mild to moderate renal impairment. Probenecid, not suitable for elderly people with renal failure. Note: need to start with a low dose, gradually increase the dose, and monitor uric acid periodically. Avoid lowering blood uric acid too quickly because it can trigger acute gout. Adjust lifestyle and nutrition. Diet: reduce foods rich in purines. Organ meats, seafood, red meat, bone broth, beer, and wine. Increase foods rich in fiber. Green vegetables, whole grains, low-sugar fruits. Drink enough water. At least 2 liters/day to help eliminate uric acid. Limit alcohol and sweets. Alcohol reduces uric excretion, while fructose increases uric synthesis. Physical activity. Do gentle exercises such as walking, tai chi, yoga to maintain weight and increase metabolism. Avoid strenuous activities or putting pressure on inflamed joints. Regular monitoring. Measure blood uric acid every 3 to 6 months. Check liver and kidney function regularly. Screening for complications. Chronic arthritis, TOFI, kidney stones. Educating patients and relatives. Understand that gout is a chronic disease that requires long-term treatment. Do not stop taking medication when symptoms disappear. Know how to detect acute gout early for timely treatment. Conclusion: treating gout in the elderly is a complex and highly individualized process, requiring close coordination between patients, doctors, families. Effective control of acute pain, maintaining stable blood uric acid levels, and improving lifestyle are the keys to helping the elderly live healthy, minimize complications, and improve quality of life. 5. Principles of preventing gout in the elderly. Preventing gout not only helps the elderly avoid severe acute pain, but also protects joints and kidneys from long-term damage. Proper prevention helps improve the quality of life, maintain independent and sustainable health. Small blue diamond 1. Scientific diet, key factor. White heavy checkmark limit foods rich in purines. Do not eat a lot of animal organs, liver, heart, kidney. Limit seafood, red meat, beans. Avoid eating hot pot dishes, strong broths many times. White heavy checkmark increase beneficial foods. Green vegetables, fresh fruits and vegetables, except asparagus, cauliflower. Fruits rich in vitamin C. Oranges, tangerines, strawberries, kiwi help increase uric acid excretion. Whole grains, low-fat milk, yogurt support good metabolism. White heavy checkmark drink enough water. 2 to 2.5 liters/day to help the kidneys effectively eliminate uric acid. Prohibited, absolutely avoid alcohol, especially beer. A trigger for acute gout attacks. Small blue diamond 2. Maintain a reasonable weight. Reduce the burden on joints and metabolism. Overweight and obesity increase the risk of gout and associated chronic diseases. Elderly people should exercise gently and regularly. Walking, yoga, light exercise. Maintain a healthy diet and divide meals into reasonable portions. Small blue diamond 3. Limit the use of drugs that affect uric acid metabolism. Consult your doctor when using long-term diuretics, low-dose aspirin, drugs for underlying diseases, cardiovascular, diabetes, etc. Do not take drugs on your own. Avoid uncontrolled uric acid accumulation. Small blue diamond 4. Regular health checkups, active monitoring, stethoscope tests, blood uric acid. Every 6 to 12 months. Liver, kidney function, blood sugar, blood pressure. Direct hit goal. Early detection, timely intervention. Family man, woman, girl, boy 5. The role of family and community. Key to supporting the elderly. Small orange diamond families need to guide to choosing the right food. Remind to comply with exercise and medication regimens. Accompanying people for regular health checkups. Create a healthy living environment and a comfortable spirit. Small orange diamond, the community can organize health communication sessions on gout prevention. Organize regular screening, uric acid measurement, and free health checkups for the elderly. White heavy checkmark conclusion. Preventing gout in the elderly is completely feasible and very necessary. With just a reasonable diet, light exercise, regular health monitoring, and family support, the elderly can live a healthy, active life without worrying about gout recurrence. Gout in the elderly is a health problem that cannot be ignored because it not only causes pain and reduces mobility, but also has many potential dangerous complications, seriously affecting the quality of life. However, with a full understanding of the causes, symptoms, treatment methods, and prevention methods, the elderly can completely control the disease well, prevent recurrent acute gout attacks, and slow down the chronic progression of the disease. Early detection and timely treatment, combined with a scientific diet, moderate living, and compliance with medical instructions are the keys to helping the elderly live healthy, active, and independent even when living with gout. Therefore, everyone, especially the elderly and their family members, needs to raise awareness and be proactive in healthcare to effectively prevent and control this disease.